Hi friends, Dr. Wayne Myers here, one of the compounding pharmacists here at Norland Avenue Pharmacy. And you should have just received some low-dose naltrexone suspension. It should have came in a bottle like this. As you, first thing you'll notice on that is it's a shake well, and it does not require refrigeration, but it is a suspension, so that means each time before you draw up a dose, you want to give it a shake, okay? You've received the bottle. It has a regular cap on it. We have a connector cap. Typically they're green. You see that there's a hole there. That's so that you can connect a syringe to it. So you'll take off the lid. You'll put the green cap on. Connector cap is what it's called. And because it connects it to a syringe, you should have received several 1 ml syringes marked with 0.1 ml markings on it. And that's so that we were going to put this in here. Again, you can give it a shake, but you can give it a shake once it's up here as well. We are going to suggest that you leave that syringe in here in between dosing. You're going to draw up a dose accordingly here. Initially, you're starting out with 0.1 mLs. So I think you can see that there, 0.1 mLs. You can turn it upright, and then what you're going to do is you're going to put this into your mouth underneath your tongue. I would suggest not touching the syringe with your mouth because, again, you want to put this back in. What we have noticed is the markings of the syringe do wear off after time, so that's why we're giving you multiple syringes. You can clean these in between, but again, it's probably going to wear off the markings on the syringe. So again, that's why you have multiple syringes. If you do take the lid off, you're going to recap it. But you see here too, so you can push it in and then it's tight. You see there's a little bit of a suspension still in the syringe, and that's why you should continue to use the same syringe here as long as you can too, so that little bit doesn't get wasted. You'll get a little bit more on it. When you're initially starting this titration, this is probably going to last you 2 months, 7 to 9 weeks. And it might last you longer based on if you're going to stop at a dose before you get to 0.9 mLs. Oftentimes we don't go any longer than 0.9 mLs. That's 4.5 milligrams of naltrexone. A few other things to keep in mind. If there are children around, store this away from where they can reach it. You are more than welcome to put the cap back on the bottle there. And I would suggest if you are traveling, maybe even to use the white cap. You can wash the syringes out and reutilize them. If you need more, if you have questions, don't hesitate to call us. Cheryl Hade will follow up with you. She's a nurse. She likes to make sure you're understanding how to utilize the naltrexone. You can ask her all your questions as well. So she's become quite an expert when it comes to low-dose naltrexone and patients' questions and concerns on that. So, all right. Hey, thanks so much. Our phone number here at the pharmacy is 717-217-6790. Thank you. Have a good day.